if John is here again, and if John has visited X-ray cabinet, in this case, has been made X-ray picture about his finger cut, his broken finger cut. This picture is stored also
in the same database.
In same database, and they have different but related databases. This is the so-called X-ray pictures database. This is stored here also. Now good, John goes home, but John has his so-called general medicine doctorate. We are calling it our family doctor. And this general medicine doctor, when John is visiting her or him, let's put it here, good. This is a general medicine. And if John visiting, let's assume this is her, good. So this doctor will get his computer, and he's checking files about John. And she sees that here is a mark about a person whose name is John with unique ID.
Yeah.
And she's getting to this database through internet. This is internet connection. But at first of all, to get this picture, she's visiting so-called Estonian e-health system. Is getting into internet. Internet is connecting to e-health system, and here e-health system gets in touch with the databases on North Estonian Imaging Center. And general medicine doctor, this is a doctor, and she's getting information that she's patient John visited North Estonian Imaging Center, and health story is recorded here. Health story will be on her screen, and also she could inspect a picture that has been made. But it's not only pictures stored here, it's also added expert doctors who is expert on X-ray pictures. She's or his opinion.
Report.
Yes, report of that. So all these documents are available to general medicine doctor. Now she will make a decision what to do next. Maybe John needed some special care. In this case, she writes a prescription or so-called, and this is also not
electronic.
Made, yes, electronically, and this is let's put it here. This is a prescription. It could be prescription on drugs or further inspection or further care. So prescription goes here and will be recorded fixed in this system. So,
but the data is not stored here. The data is only verified here.
No. Here, this is another system, which name is electronic prescription system. So this goes here, get the electronic prescriptions, and if John will visit Apoteka somewhere or drugstore, they have computer here, and they will check according John's ID does somebody made for him get prescription. If it's done, in this case, John will buy those drugs and will use it according prescription requirements. Next one is in further care. Healthcare system also records that, and he could came back to North Estonian Emergency Center, and here he will visit expert doctor. It's an expert on certain.
Say he broke the finger, right? So
yes, a certain problem.
It will be a finger doctor.
Yes, okay.
Or a plastic surgeon.
Yes, yeah, okay. And he also will see on his screen what John is sent or is recommended to be his patient. But this is not so simple because it passes also here that it is a selection window, and John has also right to select itself a doctor. If he knows somebody and maybe he has earlier visited somebody who knows his all life story a little bit better. In this case, John can make this choice also. It's a little bit depends when certain doctor has time. Yes, so free time to receive.
So the appointment can also be made by John.
Yes,
online.
yes. John will make this appointment by online because he's able to visit this so-called
Doctor that he knows.
waiting list or queue list. This is the healthcare system works. And anyway, this doctor and I didn't mention that maybe he will be recommended to visit not the North Estonian Emergency Center, but maybe
South Estonia.
Eastern Tallinn Hospital. In this case, if he will visit Eastern Tallinn Hospital and here will be also doctor on this certain problems or specific problems, in this case, this doctor will see on his screen that John has registered to his reception. So, and here also information system is running. But he doesn't know nothing, this system does not know nothing about the John. In this case, this doctor will get in touch
Back with
to internet. Internet gets connection to e-health system. And e-health system has recorded that John has records here and has records also here on family doctor computer. In this case, this system combines those two data one single list. And this is a story about John's healthcare. In this case, this doctor will make his decision, and this report and decision will be written here on this hospital's database. But remark about that will be given through this system to family doctor. She gets information that John has passed examination in Eastern Tallinn Hospital and received treatment or drugs or care prescribed by this certain expert. And I hope John is